Hi, I'm Megan Soroy. Do you give verbal permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University, class N495?
Yes, I do.
This assessment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Okay. Going to wash my hands. I have my equipment. So my name is Megan and I will be doing your assessment today. I'm going to be your nurse and we're going to do a head-to-toe assessment. Can you please tell me your first and last name?
Ashley Reynolds.
And what is your birthday?
6/26 of 90.
And that matches your armband. Can you tell me what day it is today?
Sunday.
Do you know of what month?
August 23rd.
And who's the President of the United States?
Donald Trump.
Okay, and can you tell me what we're going to be doing today on this visit?
We're going to be doing a health assessment.
Okay. So I'm going to take your vital signs. First, let's get a pulse ox and your heart rate. I'm going to take your temperature. Perfect, it's perfect. Should be. Okay, and then we're gonna get your blood pressure. Oh, it's perfect as well. Okay, and then I'm also gonna collect your weight and your height and we'll put that and we'll get your BMI from that. Okay, first I'm gonna inspect the head. Can I remove your lovely scarf? And we're just gonna look for symmetric. Nose, eyes, ears, everything looks symmetric. She's got great color. I now need to assess the facial symmetrically, and that will look at cranial nerve 7, which is the facial nerve. Can you close your eyes tightly? Now open them. Can you smile? Can you frown? Can you puff out your cheeks? Perfect, so we know that's intact. I'm going to put on my gloves, which I already have, and I'm going to assess her scalp, make sure there's no masses, no skin lesions. She's got a nice little braid in there. I don't want to unruin her braid. I don't see any lice going out. Okay, now I'm going to palpate the carotid and temporal arteries. So first we'll do this one. And we'll do her carotid. You never want to do them bilaterally. So all of those were 2+. I'm going to assess the cranial nerve 5, which is the trigeminal nerve. Ashley, can you clench your teeth like you're biting down? Perfect. Now I'm going to feel the muscles and also the temporal muscles while you do this, okay?
Okay.
Clench. Okay, now can you grate? Okay. Next, I'm going to have you, I'm going to stick 2 fingers on your jaw. Now grate your teeth and bite down. Perfect. So I'm going to assess her for symptoms of TMJ. Can you open and close your mouth? I don't feel any lockjaw. No grating. And then I'm going to feel your sinuses. Are you having any sinus pressure?
No.
Okay. Okay. Is that okay? Okay. Now moving on to the inspection of your eyes. I'm going to look at your eyelids. She doesn't have any, her eyelid sclera is white. Are you having any drainage?
No.
Okay. I don't see any redness. She's got pink. The eyes aren't cross-eyed. No strabismus. Okay, perfect. I'm going to do the assessment of her pupils. just going to peek at them. They're already constricted. Perfect. And those are 3 millimeters. They're reactive to millimeters. They're reactive to light. Now I'm going to assess the cranial nerves. We're going to do the 6 cardinal fields. I'm going to have you follow this. Perfect. So we know that's intact, which is the ocular motor and the trochlear and the abducens cranial nerves. I'm going to assess her corneal light reflex. I'm going to dim the light just a little bit, Ashley. Do you like that? Okay, I'm going to look over my shoulder. Okay, not constricted, the dim light. So pupils are reactive. Turn that light back on. How are you doing, Ashley?
Great.
Okay. So next, we're going to see if your eyes will accommodate to the pen light. So I'm going to try to touch your nose with it, okay?
Okay.
Just look over and follow it. So her eyes accommodated. Perfect. And we will now move on to inspect the ears. Put on my gloves. Ashley, are you having any pain in your ear?
No.
I don't see any masses or lesions. Skin color is appropriate. No piercings. Okay, so we're going to look in your ear. I'm going to pull it back and down. Where's that? Oh, perfect. No ear pain, you said?
No.
Okay, I see a shiny, pearly gray translucent color, so that's good. No ear infection. Next, I'm going to inspect the nose. The nose is midline. I don't see any deviated septum. Have you ever had nose surgery?
No.
Okay, so first I'm going, do you have any drainage?
No.
First I'm going to have you occlude one side and breathe out of the other. Okay, now do the opposite. Perfect. Next I'm going to look for any redness, draining, swelling in the nose. Perfect. I'm going to move on to the mouth now.
Okay.
Do you have chapped lips? Anything?
Nope.
Okay, perfect. Lips are nice or pink color. We're going to move on to the cranial nerve 12, which is the hypoglossal nerve. So I want you to stick out your tongue and move it side to side. Can you say light, tight, and dynamite?
Light, tight, and dynamite.
Perfect. Our speech is great. We know that's intact. Now I'm going to look at your mouth with a tongue depressor and see if there's any lesions. Look to see if we have pinkness. And get this undone. And we'll look in your mouth. Okay. Can you open your mouth? Okay. And we'll look under the tongue. No cavities, no mouth sores. Okay, next we're going to look at the uvula, which looks at the glossopharyngeal cranial nerve. I'm going to have you say ah and just see that uvula moving around. There we go. Moves up and down. We know that's intact. So next I'm going to move on to the neck. Once you look up, look down. Can you turn it right to left? Any pain doing that?
Nope.
I'm looking to make sure the trachea is not deviated. It's midline. I don't see any lumps or masses. And next I'm going to palpate the trachea. Okay. I don't feel any nodules, lumps, masses. Then I'm going to palpate the cervical lymphatics, which is going to be First, I'm going to do the posterior auricular, which is behind the ears. And next, the occipital, which is back of the head. Then we're going to do submandible, under the mandible. New tenderness.
No.
The submental.
No.
The superficial. And then we're going to move on to the posterior. And the supraclavicular. I don't feel anything. So next we're going to do her inspection on her upper extremities. So can you hold your arms out? We don't see any masses, any soreness anywhere?
No.
Okay, I'm going to palpate your pulse. I'm going to have both of them bilaterally. Those are both bilateral equal 2+. I'm going to check cap refill. That's less than 2 seconds. I'm going to check your skin turgor. Okay, that looks all normal. I'm going to look at your range of motion for your fingers. Do you have any deformities?
No.
Any pain anywhere? Okay. And then I'm going to palpate your brachial artery. Okay, got that. And then I'm going to check your, those are both 2+ and equal. I'm going to check your muscle strength. So can you squeeze? Okay, and then I'm going to have you push up against my arms. Okay, that's 5+ and normal. I'm going to have you move your elbow up and down. Range of motion is great. Okay, no grating. Can you shrug your shoulders like that? Okay. Then I'm going to clean my stethoscope. Here's an alcohol swab. I'm moving on to the chest. So I'm going to inspect. I've been watching her breathing. The rate's normal. On about respirations 14. Unlabored. No distress noted. No barrel chest we've noticed. So I'm going to take the small portion of the stethoscope and listen to the carotids for a bruit. Okay, I'm going to listen to heart and lung sounds. There are 4 areas that I'm going to concentrate on listening to. This will be the pulmonic. Sorry, we're going to start with the aortic. We'll move to the pulmonic. The tricuspid. And then females would be the 5th intercostal, which would be your mitral. Okay, next I'm going to use the bell to listen for any murmurs. And now we're going to, I hear no murmur, so that's good. Now we're going to listen to breath sounds. I'm going to listen first with the diaphragm of my stethoscope. Let's set up here. This is the apex. We're going to make our way down. I'm going to listen to the upper lobes. Fourth intercostal. And then we're going to do mid-axillary. 5th. We're getting there. Okay, now we're going to do posterior. So I'm going to have you, I'm going to assess, maybe can we have you stand up? That might work for me. So we're going to listen in between the scapula and the spine. Work our way down. So I'm gonna start at the apex, near the top of the shoulders again. We're gonna listen to the lower lobes. Okay, I'm gonna have you lay down, Ashley, so we can do your abdomen now. Are you having any stomach issues at all?
No.
When was your last bowel movement?
This morning.
This morning, okay. I'm gonna look at the contour of her abdomen. Okay. And then I'm also gonna see if there's any bulges, masses. I don't see anything from inspecting that. I don't see any pulsations anywhere. Now I'm gonna listen to bowel sounds with my stethoscope, okay? I'm gonna listen to all 4 quadrants, right lower lobe. Definitely have bowel sounds. So now I'm going to palpate your abdomen, okay? Lightly going about 2 centimeters. Any tenderness anywhere?
Nope.
Do you have any pain?
No.
Okay. So next we're going to inspect the lower portion of your extremities, okay?
Okay.
Are you able to take your shoes off, madam?
Yes.
Okay. I'll probably have you do that. Okay. Next, we'll just palpate your pulses, okay? Do you want to relax your legs? Okay. And we're gonna get your posterior tibial, so it's back here. I'm gonna have to take your socks off, okay? Assess your feet. And then your dorsalis, those are 2+. I don't see any edema. For your range of motion, can you stay right here? Okay. Same on the other side. Relax your feet. Can you push against me? Okay. And pull back. Now are you able to extend your legs up where your hips up? Yep. And there we go. And I'm gonna, both of those were 2+. Now can you, I'm gonna assess your tendons. So let me just grab your tendon reflex over here. Can you relax this? Nada. Okay. Okay, good. You want to sit on up for me on the edge of the bed? Now I'm going to assess your triceps too. Yeah, out. Okay. All right. So then we're going to do the gait test. So I'm going to have you walk heel to toe. Want your shoes on?
Yes, please.
Socks on. And while you're sitting there, I'm just gonna percuss the back of your, you're gonna say 99. And I just wanted to hear you do that. So you're gonna say 99,
99.
99,
99. 99. 99.
we're gonna palpate. You take in a deep breath. Any tenderness?
Nope.
Not hearing any consolidation or firmness. Okay, so now you're just gonna stand up and I'm just gonna have you walk towards the camera, heel to toe. Take a couple steps. Okay, and turn around, come back to me. Okay, now turn around that way. I'm gonna have you do the Romberg test. So first with your feet together, eyes open, and then you're gonna close for 30 seconds. Okay, perfect. No swing. Do you wanna sit right here for me? And last, we're gonna do the rapid alternating movements, which looks for the cerebellar test. You're basically gonna strike here, lift up, then strike here. Yep, keep going. I don't see any cerebellar dysfunction. Ashley, you look perfect today. Thank you for coming in and being assessed. Bye.